Hi, and welcome to Weekly Reminders. We apologize for the technical difficulties, but we thank you for being patient and tuning in. My name is Lauren Hall, and I'm a program coordinator for Remind. I hope that you are staying safe and that you're enjoying your week. So, throughout our Facebook Live series, we have been providing information on various topics such as anxiety, grief, self-care, unhealthy behaviors, balance in life, and parenting. And so we hope that you're able to utilize this information, whether to cope or to share to assist others during these challenging times. Today's topic will focus on suicide prevention, specifically warning signs, how to ask about suicide, and resources. Discussing suicide can be very daunting and uncomfortable for many of us. There is a belief that if we talk about suicide, it encourages further thought about it. However, on the contrary, approaching it in a mindful and empathetic way allows for transparency and comfort in discussing it. The reality of COVID has greatly impacted our perspective of life, our relationships, mental health, and ourselves. More specifically, this pandemic has forced many of us to gain awareness of our emotional and psychological well-being throughout social isolation. As humans, we are wired for meaningful connections. By nature, we strive to belong, to be a part of a larger whole where we can interact with each other. It's just the natural order of life. Social interaction acts as a source of comfort and affirmation for us. But what happens when that is taken away? When we are secluded or cut off from others, negative health effects happen. These effects can be psychological, behavioral, physical, or in a combination of both. In short, the effects of social isolation can be profound. While social distancing is the best preventative measures of spreading COVID-19, the side effects of loneliness, anxiety, and hopelessness can be overwhelming, thus leading to an increase in suicide ideations and or the risk of suicide. Per the American Foundation of Suicide Prevention and the Center for Disease Control and Prevention, suicide is the 10th leading cause of death in the U.S. Since 1999, the suicide rate has climbed 35%, while officials are seeing a drastic increase during this time of crisis as it relates to economic stressors, financial instability, unemployment, predisposed mental health issues, uncertainty of the future, etc. Suicide prevention focuses on dismissing the risk of suicide through awareness, direct talk, identifiable factors such as understanding the warning signs, interventions, and resource building. Suicide is complicated and tragic, but also preventable. Knowing the warning signs for suicide and how you can save a life is essential. Warning signs are indicators that a person may be in acute danger and may need help. So I'm going to provide some warning signs that can help determine if you or someone you know is at risk of suicide. Talking about wanting to die. Talks about feeling hopeless or having no reason to live. Talks about being trapped or feeling trapped or being a burden to others. Increasing the use of alcohol or drugs, which could lead to impulsive behaviors. Sleeping too little or too much. Withdrawing or isolating themselves or yourself. Showing rage or talking about seeking revenge. And extreme mood swings such as agitation, anxiety, or sadness. Once those warning signs are identified, it's important to know that your approach may have a strong impact on that person's response. So shy away from being judgmental. The goal is to keep the person safe and to determine a healthy plan of action. So according to the National Institute of Mental Health, there are 5 steps you can take to help someone in emotional pain. 1. Ask about suicide. Be clear when asking if someone is suicidal. For example, are you considering suicide? Have you thought about suicide? Asking if someone is harming themselves is not the same question. 2. Keep them safe. So reduce access to any lethal items or places. While it's not always easy, asking if they have a plan and removing the means can make a big difference. 3, be there. Listen carefully and acknowledge their feelings, even if you don't understand, just validating them in that moment. 4, help them to connect. Know available resources within your community. 5, stay connected, follow up, and stay in touch. Now, if you are personally experiencing emotional pain, here is a suicide prevention plan for you. Recognize symptoms for what they are. So being honest with yourself. Write down your thoughts. Being able to utilize a journal as your canvas to express how you feel and your thoughts. Make a plan for your life. Give yourself time to get better. Stay connected with trusted friends and family, as well as your doctor. Join a support group. Avoid drugs and alcohol. And know when it's best to go to a hospital to seek higher levels of care. Now, we know it can be hard to talk about this subject, but remember, there are also professional services that can help assist you. So some available resources. If you or someone you know is in a crisis, including the risk of suicide or self-harm, help is available. Call the National Suicide Prevention Line at 1-800-273-TALK. Once again, the National Suicide Prevention Lifeline number is 1-800-273-TALK. For residents of Texas, call 833-986-1919 to speak with a mental health professional and or 211 for additional resources. Now, there's also a crisis text line, which is also available with trained counselors. And you text TX to the number 741-741. Once again, text TX 741-741. Let me know your thoughts about today's series. Thank you again for your patience with our technical difficulties and tuning in. Please stay safe and connected. Join me next Thursday for our discussion on setting healthy boundaries. Also, make sure you visit our website at reMINDsupport.org and also sign up for our online support groups, which start on Monday. Have a great weekend and thank you for tuning in.